And also I support the expansion of industrial hemp production in Kentucky. So I'm going to take this opportunity to ask Adam Edlin and Andy Beshear to drop out of this race because a crook has no chance against Matt Bevin in November.
Okay, let me give just a quick response if you want to that quickly.
Bless his heart. I've beaten Matt Bevin time and time again, and I'll do it in November.
Co-defendant and co-conspirator of Allison Grimes. I met with Mr. Adams because I wanted to let him know that I was strongly considering running for Secretary of State, and I knew he was someone with the same ambition. So upon hearing that I was a potential rival, Mr. Adams panicked. He began by offering me a six-figure bribe to not run against him.
Shannon Cogan with Wave 3 News in Louisville.
And I'm Bill Bryant from WKYT in Lexington.
Mr. Beshear.
A pension is a promise, and I was raised that when you make a promise, you keep that promise.
In the face of rising health care premiums and uncertainty surrounding what remains of the Affordable Care Act, what would you tell someone who is worried that they won't be able to afford health care? Mr. Edelin, we'll start with you.
So now the question is, what are we going to do about health care in Kentucky? And I want to note this, so pay attention when you watch the clip, that none of them, except for one candidate, says universal health care, single-payer universal health care. They do not say universal health care. That's important. Okay, so Adam Edelin, he recognizes that Kentucky has the worst health outcomes in the nation. In all the 50 nifty United States, in all of America, Kentucky is sick. Adam Edelin recognizes that in all kinds of outcomes. So Kentucky is sick, is very sick, and he blames the fact that large masses of Kentuckians don't have health insurance. So he knows that health insurance is important. He says maybe West Virginia might be sicker, but he knows that Kentucky is one of the sickest states in America. Adam Edelin also mentions pre-existing conditions. He also mentions strengthening Medicaid expansion. Both Andy Beshear and Adam Edelin are going to say pre-existing condition. They're both strengthening Medicaid, right? So they give all these good words. They understand the issue, but they don't say universal health care. Adam Edelin says that you must have investments in health care. So he says, I guess he's looking at the business side of it. Adam Edelin has said that he is for private and public health insurance. So he wants to protect both groups of people, private and public. And Adam Edelin wants to take power away from the for-profit health insurance companies. So he wants to dim the power of the private insurance companies. He wants to have investments in health care. He's for Medicaid expansion, against denying people with pre-existing conditions. He says he's got a brother who has Down syndrome, so that'll say something to his character. So that's why, one of the reasons why he cares about health care and pre-existing conditions. But he doesn't mention universal health care.
Well, in Kentucky, we've tried the experiment of having a large uninsured population for about 100 years. And what it gave us was a system that was nearly bankrupt and the worst health care outcomes in America, with the exception of West Virginia and Mississippi. Folks, we need to stick to the Medicaid expansion. We've got to strengthen it and protect it, because over the long term, it is certainly cheaper and more sustainable to have people insured rather than uninsured. And so whether it involves protecting people with pre-existing conditions like my little brother Austin, who has Down syndrome, or whether it means strengthening the protections that we have, we've got to have a governor who understands that for a state that is as sick and unhealthy as ours, we need to make investments in health care, that over the long term it is much cheaper and much sustainable. And we need to have a governor who also understands that we've got to drill down and make sure our health care system is working for the benefit of patients and providers and the taxpayers who pay the freight, not the for-profit insurance companies who have been trusted to administer our Medicaid program.
Rocky Atkins, he mentions that Kentucky's uninsured rate went from 19% down to 6%. 19% down to 6%, and then Matt Bevin gets in there, and now he's kicking people off of health care left and right. So Rocky Atkins is against Matt Bevin's policy of kicking people off of health care. and he mentions that healthcare had, the insurance level had gone down, but he didn't mention universal health care. He didn't mention universal health care.
Mr. Atkins.
Expansion of Medicaid is one of the finest things that we've done in Kentucky. To drive down the uninsured from 19% to 6% has been a heroic effort, in my opinion, to get our population across Kentucky insured. I would tell you this action by the governor with his waiver to try to take 100,000 people off the health care rolls is wrong. It's wrong because these are folks working 2 jobs a day for the first time to have health care for themselves and their families. But it's not only important for those who need health insurance, it's important for the healthcare industry, an industry that's one of the greatest economic drivers in the Commonwealth of Kentucky, that employs hundreds of people from rural areas of this state to thousands of people in urban areas of this state. If we're going to have a healthy economy, then we got to have a world-class public education system, and we got to have a healthy healthcare industry. Some regions of Kentucky, without a growth in the healthcare industry, would have seen a total collapse of the economy over the last 5 years. A healthy healthcare industry is a must.
Jeff Young, he's a Bernie Sanders Democrat, and like Bernie Sanders, Jeff Young has advocated for universal health care for decades. Specifically, Jeff Young likes John Conyers' Medicare for All bill, HB 676. And Jeff Young said that if the federal government doesn't get HB 676, he'll institute HB 676 in Kentucky, which means that Kentucky will be one of the few states in the union that has universal health care. So if Donald doesn't get us universal health care, which he has not said, he's been shitting on single payer ever since he's been the candidate and president. As a citizen, he knew it was a good idea. His friend went to England or some shit, and it was awesome. Scotland. Australia, he recognizes Australia's healthcare system is better. So even though I think Donald Trump personally believes that universal health care is fine and dandy, Rand Paul was able to push him to the right during a debate. That's the power that you got during an election. You have the power to change the narrative. So Donald Trump used to be for universal health care, becomes candidate, tells Rand Paul after he says something about it and makes fun of his face, says, I don't think you're listening. I've never been for universal health care, even though he said it like 5 different quotes, 5 different times.
Mr. Young.
As a Bernie Sanders Democrat, I have supported single-payer Medicare for All health insurance system for many years. I'll work toward that, of course, defend the people who now have health insurance, but a single-payer system, nationwide if possible, if not possible in Kentucky or our region, will actually lower health care costs by eliminating the profit motive from the health insurance industry. Basically, the best bill, the gold standard, introduced by Representative John Conyers in the U.S. House starting in 2003 until he retired, lowers costs by making our health care system non-profit again. And it was in the past. There didn't used to be health insurance corporations that we were paying our premiums so they could deny our claims.
So it's clear that the federal government under Donald Trump will not get universal health care. So how is Kentucky going to get universal health care? If it's not from the federal government, it'll be through the state government. That's obvious. That's common sense. Jeff Young said he would do that. Andy Brashear, he doesn't go into detail. He doesn't talk about HB 676 or John Conyers' Medicare for All bill. He does copy Edelin, or maybe Edelin copies Brashear. They're both talking about pre-existing conditions, strengthening Medicaid expansion. Something interesting, Andy Brashear had mentioned that he had sued the 3 largest insulin companies for charging $300 for a $7 vial of insulin. So the insulin costs $7, and these for-profit companies are buying it and taking the rights to it and then jacking up the prices to $300 fucking. So Andy Brashear is suing these largest insulin companies for doing that, for price gouging. You could get a lot of medicine in Canada for way fucking cheaper prices. So the free market isn't working. The free market is fucking over Kentucky. and Kentuckians and Americans when it comes to getting the medicine that you need. Andy Brashear specifically says, tell that to 8-year-old Lucas. So you got an 8-year-old Kentucky boy named Lucas who has type 1 diabetes. So you're going to tell little 8-year-old Lucas that because of capitalism we're going to, rake him over the coals and his parents when it comes to charging all this money? And what if he doesn't have insurance? When it comes to insurance, yeah, that probably is nothing. But if you don't have insurance, that's a week's pay for the Clay Countyans. Andy Brashear also falsely claims that he's the only Democrat in the race that has a health care plan. No, Jeff Young has a very specific health care plan. John Conyers' Medicare for All bill, HB 676, which is considered the gold standard for universal health care. So Jeff Young has a plan, but Andy Brashear claims he's the only one that has the plan, which means perhaps Rocky and Adam Edelin does not have a health care plan. And his plan puts the federal health care reforms into state law. So, the aspects of Obamacare, you could stay on your parents' insurance till you're 24, Medicaid expansion, pre-existing conditions, you wouldn't be kicked off for pre-existing conditions. So these laws, he's going to put it into the Kentucky State Code. But again, like Rocky Atkins, like Adam Edelin, he didn't say universal health care. He didn't say universal health care. His health care plan is going to expand Medicaid and lower the cost.
Thank you, Mr. Young. Mr. Brashear.
Healthcare is a basic human right, and everybody ought to be able to go see a doctor if they're sick without it breaking the bank. But as opposed to just talking about healthcare, folks, I'm fighting for it. I'm in 3 national lawsuits that are the fight of our lives. Our federal government is trying to tear away mandatory coverage for pre-existing conditions. That's half of all Kentuckians. They're trying to re-allow discrimination, charging women more than men for the same policy. They're trying to reinstitute lifetime caps where somebody with a chronic illness will be out of money and out of luck. But I'm also going after any company that would try to gouge people who need that medicine the most. On Monday, I sued the 3 largest manufacturers of insulin. They manufacture 96% of the market. It costs $7 to create a vial of insulin, and they're charging over $300 for it. Tell that to 8-year-old Lucas, who suffers from type 1 diabetes. It is wrong. But I'm also the only candidate in a Democratic primary that has a health care plan. It's on andybashir.com. It puts federal health reform into state law, lowers all of our costs, and embraces expanded Medicaid.
Not universal health care. And Andy Brashear even says that health care is a basic human right. So he says all the right words. Healthcare is a basic human right. Unless you live in Kentucky, then fuck you. The 6%. And that's another thing, Kentucky. You only got 6% who's not covered. So if you were to get universal health care just to cover the 6% that's not covered, well, that, stops STDs from getting into your home. That stops, all the communicable diseases that these other dirty people that are sick and not getting any help could get to you and your family. So if you don't give a shit about other people, then you should support universal health care because you give a shit about yourself. So Jeff Young was the most progressive when it comes to universal health care. Rocky Atkins was the most conservative. Adam Edelin and Andy Brashear had 2 different ideas. So Adam Edelin is talking about taking the stuffing out of the pro-profit health insurance companies, but he's going to protect private insurance. And he's talking about investments in health care, so is he talking about public spending? Andy Brashear is suing the insulin companies, the 3 largest insulin companies. So Andy Brashear will be about reduced costs against price gouging, so he's doing something about it. And he also says that he wants to take Obamacare and put it into state law. So that's, remarkable. That's going to make it permanent for Kentucky. You cannot deny people for pre-existing conditions. Expansion of Medicaid is here, and he's got some other ideas about lowering cost. So Andy Brashear has the most developed plan between the 3, lesser of the Jeff Youngs, right? So between the 3 bottom people, Andy Brashear has a more developed plan. Adam Edelin realizes that Kentucky is sick across the board. Rocky Atkins really hates Matt Bevin and his policy of taking people from their health care. But only Jeff Young is for universal health care. Only Jeff Young is for universal health care. So on marijuana, Jeff Young is more progressive than all the Democrats, and on health care, Jeff Young is more progressive than the other 3 Democrats.